And we're recording.
And we're on what, episode 10?
Episode number 10 of Illumisoft podcast.
That's crazy. It is September 18th, 2020.
And I'm Dan Prince.
And I am Matt Heelan. All day, every day.
All day, every day. All right. Well, good to see you again, Matt.
Yeah.
What's going on this week, man?
Well, as I always like to do, come prepared for the podcast. Just some interactions with potential new clients, I guess, that I just wanted to kind of go through. Just what I've kind of learned this week that'd
be great.
Yeah. And then also, I would like to hear about the day in the life of a small business CEO. I would like to have you talk about what it's like every day to kind of run Illumisoft. I think that would be interesting from a person who, again, I always think the audience members might be small business owners as well. And, you know, they might be able to glean something from the way that you approach running your business every day, right? So.
Okay, I can tell you what I do. I'm pretty confident that I have no idea if it's the right way or not, but I know it's been working for me. So
there you go.
Sure.
So anyway, those are the couple of things that I was going to jump in and talk about. What about you? Do you have anything on your list of things?
I read at least one article this week that indicated wearables, and you shared something in Slack talking about the new Apple Watch.
Yeah.
So I thought we would just talk about wearables and you know, I don't know if there's a whole lot to talk about, but I'm thinking about buying a new one called a Whoop strap.
Yeah.
Joe Rogan talks about it. He sponsors it, but I've seen a number of people have them, and it would be nice, in my opinion, to be able to monitor my activity, all the things that it can measure, heart rate, oxygenation. It keeps track of how hard you work. I'm led to believe. I don't have one, so I really don't know for sure.
Right.
But it can let you know, if whether or not you can expect to have a day where you can work optimally. So like right now, it's Friday. I've worked out every day this week, muscle building, bodybuilding, whatever you want to call it. And I am sore. I'm looking forward for tomorrow to get here so I can just not do that tomorrow and just rest and relax. And I'm guessing that if I had a Whoop strap or, anything that could really do the job, it would tell me that, it's probably better you just rest today.
Sure.
And I think having that, making data-driven decisions about your health.
Right.
It seems so archaic to do it any other way at this point.
Right. So to that end, one of the things that I learned this week was I attended a webinar sponsored by a company called Giant. It's Gyant. They make a patient enablement platform. And they also, the guy that was on it was a guy who's a director of consumer experience I think is what his title is, for Intermountain Hospital System, which is in Utah. And they described a number of projects that they had worked together on. And what was interesting about it was really them describing how they kind of worked together. They were working on what they called like a patient front door to a hospital, right? So digitally, as somebody were to walk into a hospital, what is their user experience, right? And then they also talked about how they were working on that, and then they had to sort of pivot to a COVID tracker. And so they talked just about how that whole process worked and what it was like to work together. But one of the interesting things that they talked about was Giant is still considered to be a health tech startup. They haven't been around long, probably less than a couple of years. They're still getting funding from other sources. So they asked this guy at Intermountain, they said, well, what's the experience been like, overcoming working with a startup company versus working with, say, a more well-established company? And he said, honestly, it's been good because they're willing to take more risk with us than some of these more established companies would be able to take. And I immediately just thought of our relationship with Children's Mercy and our approach to that, and how I feel like it's a little bit similar to that we're willing to take a lot more risk in that relationship with them, because while not necessarily could we be qualified as a startup at this point, but we're still relatively young, that we still kind of function in the way we think about things kind of in that way a little bit.
Yeah. I wonder why a bigger company isn't willing. I wonder what kind of risk they were taking with them, but it seems a little bit at odds that a larger company with more resources, and they're probably a higher billing rate, and they're having more people in their billable, aren't willing to do even more of that.
Yeah, the Intermountain guys said they were really, what was the word that he used? He just said they were eager. They were eager to earn their stripes. This was their first healthcare client that they got. And he said that their team was willing to just respond like that because they were hungry, I think is the word he used. And then they asked the CEO of Giant later on in the interview, they said, how has this translated to growing your business? Mm-hmm. And he said, and before he could answer, the guy from Intermountain interrupted, and he said, I can tell you how it's helped. Is now they've went from 0 to 1, and that's the biggest leap. And he said that I know, because I get approached by vendors all the time, that when I look at somebody and they already have a relationship within the healthcare market or with a hospital, he's like, I immediately will take their call. I will immediately look at their presentation because I know they've earned their way into our industry, and that takes something.
That's some insight. That's interesting to have, right? Because we've got some insight, some connections in the industry. So
absolutely.
Awesome.
So listening to that webinar, I thought it was really good to kind of hear an actual person on the ground besides everybody we talk to every week at Children's Mercy, right? Sometimes you kind of you got to stand outside of that a little bit to say, hear somebody say it a different way, or hear somebody say how they kind of view you as a company, right? Trying to get into their circle, if you will. So I thought that was really helpful. The second thing I was thinking about this week was, not to do any kind of self-promotion here, but on September 29th, I got asked to be a panelist on this webinar called Today and Tomorrow. Kelly Seminovich runs a company called Integrated Care Strategist. I got connected with her through one of our sales campaigns. And in doing so, I got asked to put together a kind of a presentation for...
like you do.
Yeah, and just a presentation for... Their focus is on where is the innovation going to come within the care continuum. And those are big words that you don't know really what they mean, but really what they mean is from the point that a person walks into a hospital to the point in which, let's say, they're out of the hospital and they go to some other facility. They go to a nursing home, or they go to like a post-acute care, right? The problem that they're seeing is the innovation's happening very, very, largely in the hospital setting. But outside of the hospital setting, they're wondering where the innovation is going to come in those different areas. So as an example, one of the articles I read said that they can envision telehealth being an expectation that we have in nursing homes. It just seems like a no-brainer. It's like, nursing homes are the perfect place where now we don't have to take you out of a nursing home and take you to the hospital. We can treat your symptoms within a telehealth solution. So outside of a hospital, where's the innovation coming from? And that's what the presentation is supposed to be about. So as I do a lot of research, and I came across this Gallup study that I thought it didn't make any sense. And before I tell you what the study said, I just ask you, are you currently happy with your health care?
Before I answer that, let's take a quick break.
Right. Okay.
Okay. Am I happy with my health care?
Yeah.
No, I'm not. Okay. I'm not. The deductible is too high, and it seems to me that there are very few things that don't require me to pay for them out of my deductible. So it seems to me with a $7,000 deductible that I've got to spend $7,000 out of my pocket before I can even utilize this $800 a month insurance that I've got. So no, I'm not happy.
When you have accessed your health care this year, in terms of like providers, like going to the doctor for whatever, and I know you don't go to the doctor a lot, but have you been satisfied with the care that they have given you?
I actually have been very happy with the care that Spira Care has given me, and the doctors that are the primary care physicians there have been awesome.
So maybe this was because of my personal recent experience with healthcare, but Gallup took a poll in 2018 of not whether you liked your health insurance or not, just whether you liked your health care that you got. And 80% of Americans said they were happy. And I read that and I thought, that can't be true. That there's no way that can be true. But Gallup's been around a while, so I kind of trust their numbers, right? So I guess that's where I kind of took the presentation a little bit in terms of, if that's true, then where does innovation in healthcare come from, right? What other ways what can we do to kind of continue to improve that level of satisfaction that people have? And a lot of people are continuing to point towards, digital innovations in healthcare, right? That the more that we can move and this is part of my presentation as well, is there is this now kind of concerted effort to move from a fee-based healthcare system to a value-based healthcare system. And value-based means we understand what we're paying for. Hospitals are getting more effective at treating us because they have more data, right? So if value in the healthcare system is going to be where a lot of, and even our client, Children's Mercy, I found a presentation that they had put together about what they consider to be a value-based approach. And then the question is that what role does technology play in increasing the value that people can get out of their care?
Well, so I'm not sure I'm following you. So you read a study that talked about people's satisfaction with health insurance or with health care?
Health care.
And when you talk about health care, what are you talking about specifically? What did they add? What did they say that entailed health care?
I'm happy with my primary health doctor. I'm happy with my interactions with nurses, all the things that go into how you interface with healthcare.
Okay, so you're interfacing with it. Yeah. Because, you can draw a big sphere around what healthcare is, right?
Sure.
Insurance companies and...
Right.
Yeah, so, okay. So people, if I understand you, and the study is correct, people like dealing with their doctors and nurses and practitioners. They think that they're fine. And why wouldn't you? Because they're people and they're nice people. I think they even have to take a class about a bedside manner.
Right.
So if they're satisfied with the human side of healthcare, where will innovation come from?
Right. Mm-hmm. And the question is that, and I think it goes back to your comment about the Whoop watch, right? Which is
the strap.
Strap, sorry, or the Apple Watch that we just talked about, is whether, this is something that I listened to on the radio driving in today, is there is never a better time than right now to be in shape.
I wholeheartedly agree. Why do you say that, though?
because they say that if you look at COVID as it's a healthcare crisis, right?
Mm-hmm.
And so for people who want to be healthy, there is so many ways and tools for you to learn if you're healthy or not. There's so much data out there available to you to say, yes, Dan, you're healthy or you're not healthy, right? There's just the litany of tools that you have at your disposal to say, if you really want to be healthy right now, we got all kinds of stuff for you, right?
It takes a little bit of work,
right?
But you can do it,
right? And so that's part of the presentation that I'm going to give is just talking about where innovation might come from. And honestly, after I put the presentation together and I was thinking about it, I kind of feel like the message isn't really one of like more innovation, right? I think that in a way, when I was talking to the woman that's running the webinar, she just just off the cuff wrote, Matt, the last thing I need is another app. That's the last thing I need.
You kind of lost me. So you said more, but I didn't get the context around that. More innovation is what you're saying?
What I mean is I think we need the right kind of innovation, because what's happening now is if you think about this for a second, is if me and you, right, we work in a technology company, and let's say we knew someone who had to go to the hospital, and we could just be like little shadows of them, right? And we could just follow them as they walk into the emergency room. And then we could follow them, and we were doing what's in a lot of cases is known as like the customer journey, right?
Sure.
And we could follow them through, and at the same time, we could follow them and say, what kind of technologies are you interacting with, and are your physicians interacting with?
What kind of technologies affect their experience?
Yeah. And obviously, we know that in most hospitals, there's a doctor there working on a Cerner platform or an Epic platform, right? There's a nurse that might be using some other, right? But by the time you would walk through that entire person's journey to the moment they were discharged, it would be a collection of a lot of technology. And it might be confusing to the user or the patient, but also to the clinician, right? The clinician may say, Lee, I've got all this technology available to me. It's like too much for me to manage all this stuff, right?
Right, but then should he be the one managing it, right? And I know physicians that are technologists that overdo it,
right?
Because they know if a little technology helps, then a lot of technology should help a lot,
right? And I guess what I'm wondering is what if the question isn't we need to innovate more new stuff, but we just need to innovate the right stuff and figure out the way for it to really integrate tightly with what already exists. Right?
Yeah. And I think there's a lot of stuff we can do today, or we can imagine that it's doable. But there's some stuff that we're on the verge of doing. And I think in healthcare, the horizon is huge for what is possible to do. And I think there's so many companies right now that are working on wearables, right? Clearly a front runner for innovation in healthcare. But other things like diet and like Viome. Have you heard of Viome?
Yeah.
Viome can break down your microbiome into its individual constituent microorganisms and tell you what each of those this is what they claim they can do. They can tell you what each of those organisms both takes in and expels, so that you can then determine whether or not you are taking in the right nutrients to support the right organisms, so that the result of their output, chemicals and other things, are optimal for your system.
Right.
The technology, I understand it, what it could do is beautiful. I don't think that they're all the way there yet. Right. Even if they could determine that, I don't think we know what our correct makeup is. And so how do we use this technology to change something that we're not really sure of? So I think wearables is a big thing for the future, not just wearables, but anything that we can use to gain more data into what our body's doing and why is going to be beneficial. But honestly, I think the biggest innovation in healthcare is going to be in data analysis and maybe artificial intelligence and pre-diagnosing people. I don't think we're going to have artificially intelligent diagnosis. We will have artificial intelligence assisted physician diagnosis.
Right. Yeah, and I also think we're already doing this, but just in terms of disease treatment, right? You know, the mortality rate will continue to go down because we're getting better and better at treating people with chronic diseases, right?
Why do you think that is, though? I mean, what has innovation changed? How has innovation enabled us to treat people better?
If you look at immunotherapy as an example, you know, I mean, it in cancer treatment especially, it used to be, and I'm no physician, but it used to be that we would go in, you know, with chemotherapy and we just wipe you all out and kind of hope that what's left will keep you alive, right? Whereas immunotherapy is a little bit more targeted. Mm-hmm. It's trying to use your own body to defend yourself against disease. It's a smarter way to do it, you know. And I think that's an innovation, right? And I also think that, you know, one of the things that is the data analytics that you're talking about where we can really begin to leverage that is to say, you're a 49-year-old male, you have prostate cancer, based on your biologic makeup, we know that the best cancer treatment for you is this, and here's why we know it. Because we have looked at 50 million 49-year-old males that have had prostate, you know, so they just know that this is the treatment that you need. And unfortunately, right now, while I think we've gotten better at it, I think right now there's a lot of people that might suffer for a long period of time or die early because it's not a tailored solution to you, right? It's just this throw the biggest thing that we know works at it and hope that it works.
It's a statistical solution. Yeah, and it should work for most people. At least that's what we think. Right. Sometimes when I think about healthcare, I don't know if we're still in the dark ages or not. I mean, because our bodies are so complex and there's so little, there's a lot that we know about them. I mean, I certainly don't have a doctorate in biology or, you know, anything like that, but I know that I can go out and find online more information than I could possibly consume about health, about your body, about everything that you might ever want to study about it. And still, I think that our body of knowledge with respect to, you know, who we are as, you know, mammals and how our brains work and all that stuff is just minuscule compared to what I think it will be once we once we grow into it.
And when I talked to Kelly about the presentation and everything, I just sort of offhandedly said to her, you know, we have this experience with this cardiologist out in California who wanted to look at his population of people and their pacemakers, and he wanted to figure out which one of them had this model because that model was bad. And he wanted to treat those people before he treated the other people. Mm-hmm. And you would have thought that I said something more like that was profound, right? And she's like, well, that would be awesome if we could do that.
We can do it.
Right. And I thought, well, yeah, you should be able to prioritize how you treat people, right? I mean, you should be able to have this dashboard of your practice and say, you know, here's today's priorities, right? And so, but yeah, I am seeing through the conversations I'm having a lot of, there is, and this has been going on for a while, there is this sort of other change that's going on, which is like turning healthcare into a more consumer-driven experience, right? Meaning that previously, like one of the questions that they asked, let me pull this up real quick. This was a
consumer-driven healthcare.
Right.
I mean, to an extent, we're already moving in that direction, because if you haven't done your research about what your problem is and, what your symptoms are, and be able to communicate those clearly with your provider, if you haven't done that, your experience in the hospital is not going to be a good one.
So if this is a survey that was done in 2020, said how likely are you to tell your doctor when you disagree with him or her?
I'm 10%.
So, and it falls in line.
Yeah.
So they looked at Gen Z, which is my daughter's age, to my parents' age, which would be, baby boomer generation, right?
All right. So they broke it down into categories or to generations.
Yeah. And of course, my parents were like, you're the expert. Tell me, what do I need to know? You ask Maddie, she's like, you're full of shit. I'm going to go out and Google that, or I'm going to go out. And so that tells you how attitudes towards healthcare have changed. Right. And that more information has put us more in control as a consumer. Right. So normally if we had to go through our customer journey again, and we walked in behind that person into that emergency room, it used to be that you would just go in and you would just say, treat me and I'll trust what you guys are going to tell me. Right. Yep. But now you go into that ER and you think, I don't know that I believe everything that you tell me is the best way. Right. So now as consumers, we're becoming more and more sophisticated with the way we interface with healthcare, because, and so now you've taken an industry that was not really treated as a consumer experience and moved it more into the realm of, like, when I get something from Amazon, right? I expect it to be delivered on time at the price that I bought it at, right? So now it's all the elements of consumerism that me and you are accustomed to in every other part of the world has now landed into healthcare in the way that we are going to look at it.
What do you think about that?
I think it can only benefit us.
I like it.
Yeah.
I mean, I think the times that I've interacted with a healthcare provider that were not pleasant to me were because that healthcare provider had a superiority to me, right? He was the authority, and he looked down at me and was condescending to me. And so when I said to you, I probably only 10% likely that I am going to disagree with a doctor, it's 90% likely that I will not agree with him.
Right.
But I won't disagree with him. I'll just take it in and do what I'm going to do anyway.
Right.
Because I know how they're trained, right? They know what they know, and they're taught to think that they know everything there is to do with health, but they know they don't, right? There's other ways of treating that they're not allowed to be taught, and that, in other parts of the world are producing pretty good results.
Well, and to go back to the innovation part, though, is that, because there is so much data every day being just generated about healthcare, whether it's scientific publications or a new app that tracks this, or a doctor who's got to keep up on this. The challenge for a doctor to stay current in the medical community is hard. Right? Because, it's hard for them to keep up with all the content that's generated every day. Right. And so sifting through what's real and what's not, and what's a good practice and what's not a good practice. I can imagine with all that data out there, it could be even analogous somewhat to software developer, right? In that a software developer has to keep current on all the current technologies, because they don't know if this one will work for their client or not.
And a lawyer's got to keep up on all the new precedents that have been set. It's a challenge.
One of the challenges I think that we face is how do we not be, we talked, I think on the last podcast about not being a part of the noise, right? And I think that's one way to not be a part of the healthcare technology noise, is to say, you come to us as a potential client with a solution and you're in the healthcare world. As we would answer some clients, we might say, no, you don't need us to build you anything. What you need to do is take that thing that already exists and put it with that thing, and then that will give you everything that you need, right? But in a lot of cases, because of the sort of opportunity that technology companies see, is they know there's a current solution out there, but they're still going to go build their version of it.
I hope there's not a whole lot of companies out there that are doing that, but yeah, it's possible. You may not know something exists that does exactly what they need and is inexpensive or even free.
Right.
But how much time can you put into that for free, right? So you either sell yourself as a consultant and you go out and do the research for them, and or you sell yourself as a service and they're asking for your service.
Right.
So in a sense, I would hope that companies would realize that other service providers like mine, like this company, would realize they're not in a service provider position solely, right? They have to be a guide. They can't just take somebody's money knowing that there is something else out there. The other side of the coin is that they can't invest all of their own money to make sure that they're not taking the client's money unnecessarily.
Right.
But what they can do is they can mix those two things and say, look,
Right.
I don't know, but I can go do the research. There seems to be a conflict of interest there, and that's why I don't think you see anybody doing that. Because if they don't find anything, then they get to build it for $1 million or whatever. Right. If they do find something, then they get to only collect, the 4 hours of consultative fees for finding that solution.
Right.
Which should you do? I know which you should do, and you should always take give them the cheaper solution, the one that works,
Right.
and hope that they don't want it and they want you to build them one anyway.
Right. Right. Yeah. I guess what I'm keep trying to point out or get to is that, with so much innovation going on in healthcare and continue to be, especially after COVID, that, you've got to stand in the shoes of the people who are delivering it, right? You got to say, what does it feel like with all this technology around me? If I'm a doctor trying to do my job, is it making my life easier or is it making my life more complicated? Is it making it more challenging for me to deliver healthcare to this person, or is it really as beneficial as everybody thinks that it is, right?
Yeah. Those questions are absolutely right, and they're not something that we can answer.
No.
But I think it's because the healthcare is changing rapidly, just like everything else. I mean, if you think about it, the roles that doctors played in, say, 100 years ago or even 50 years ago, right? They were the ones that collected all the data, right? They were the ones that had all of the knowledge, and they made a decision, and your life hung in the balance, right? That's not so true anymore. We have systems that keep doctors in check, right? They can't just give us 1,000 milligrams of morphine without something in the system going, hey, wait a second.
Right.
And I don't know if 1,000 milligrams is a bad amount or whatever, but
Right.
if the doctors are administering something, I know there are checks and balances in place that limit the damage that they could do today, whereas, in the past it wasn't. So doctors' roles are changing. What is it in the future, if you can imagine, 10 years from now, in the Jetsons age of healthcare, what role will the physicians play? What will be their key value add to the healthcare system? Because we're putting systems in place because systems are always the same, right? And if it misbehaves, you tweak it a little bit and it does better, right? We want autonomous drivers because they drive better than my mom does.
Right.
I'm sorry, Mom.
Right.
We want that in healthcare too, because robotic programmed surgeons will do a better job.
Right.
If they're programmed correctly, then, a tired or worn out or stressed or emotionally.
But I think there is this
challenged physician
sort of connection though to, I think one of the things that's happening right now, which is the human connection. of treatment, right? I mean, is it do we start to sort through which ones we need a real person or which ones we don't, right? Do we go, if it's just surgery, I'll take the robot. Mm-hmm. But if it's like, I need somebody to, like I can't imagine, well, I can't imagine a lot, but I can't imagine going to a therapist who wasn't a person, right?
You mean like a counselor or, or a physical therapist?
But not like a counselor, right? Like I can't imagine saying, Siri, I'm feeling depressed. And then Siri says to me, well, Matt, that I can't imagine that experience. I'm not saying it's not possible, but I think that one of the things that a pandemic and lockdown and those types of things teach us about is how much we value human connection, mm-hmm. right? And so the question is that what would the role of a physician be in the future? Maybe it's just that they're a human.
And that ties right into the fact or the stat that you quoted earlier. It's like people are satisfied with the human part of healthcare. What they're not satisfied with, I'm going to guess, as a representative sample, is the quality of the result, right? We know physicians are taught to treat symptoms. They're not taught to dig into the person, not dig into them, but find out what truly is causing those symptoms. They treat symptoms over and over and over. And it doesn't take a whole lot of intelligence to ponder whether or not treating the symptoms is not as efficient as maybe treating the reality, which is probably food-based or environment. You're living in a house with lead paint or moldy walls or whatever. So
that's why one of the guys that I talked to this week, his name is Kevin Reynolds. He's with this organization called the Wisconsin Health. It's a not-for-profit. I can't remember their full name. But basically what they're doing is they're looking at Medicaid and Medicare claims. And what they're trying to do is they're trying to analyze across the entire state how they can improve treatment. Machine learning, all kinds of opportunity there, right? And that's the core part of their exercise, which is that they want to understand what is it that our states are paying for in terms of care and what are we getting out of it in terms of care, right? If we, to your point, if I'm a state Medicaid, Medicare program, and I realize all I'm doing is paying for people to sign off on their symptoms, and we're not treating the root cause of what it is, we're not getting the best trade-off here for our money. Right. So I guess maybe what we're driving towards is a human being, but equipped with an enormous amount of data to be more effective.
AI-assisted physicians, I think, because we trust people. And even if we don't trust them fully, we do trust that artificial intelligence probably has the right answer.
Right.
But I don't think we would trust the artificial intelligence to deliver it to us.
So this will maybe connecting back to your Whoop.
My Whoop strap.
Yeah. So this is not real recent, but so in the last 12 months, this was taken in, the survey was actually in 2020. In the past 12 months, have you used any technologies, including websites, smartphone, tablet apps, personal medical devices, or fitness monitors for any of the following health purposes? It looks like it went from, in 2013, 17% were using it for fitness and health improvement goals, exercise, diet, weight, all that. To 2020, it's now at 42%.
Wow.
Right. So same question, but for monitoring your health issues. So blood sugar, blood pressure, mood, et cetera. So 2013 was at 15%, and it's risen in 2020 at 28%.
That's still significant. I mean,
It is. It is significant. And I think it has only gone even higher in the pandemic because of necessity, right?
Why necessity?
So
I mean, people have stopped going in to get,
I'm envisioning that as as the sort of quote unquote telehealth sort of wave or explosion has hit, that doctors have said, if I'm on the phone with you and you're saying, I don't know, I feel like, classic symptoms of high blood pressure, whatever those are. Well, Dan, why don't you go out and get yourself a wireless blood pressure monitor or a Bluetooth synced blood pressure cuff or whatever, right?
Sure.
So next time we have a video call, I can instruct you on how to take your blood pressure, and then you could tell me while we're on the call what it is, right? And each time we have a session, each time we have a visit, you can take your blood pressure and we can kind of know where you're at, right? So I'm imagining that it's accentuated, if you will, the need to go out and get devices, right?
Yeah, and that was one of the things I want to talk about. I know a lot of people are doing telehealth, and that's great for conversations. But we've had that ability for a long time, right? Just pick up the phone and call them. But doctors won't answer the phone.
Right.
So now they're answering the phone because they can do an office charge for it and not have to have anybody in their office or pay the fees associated with office space.
Right.
So I think it's wonderful. I think it kind of sucks for the physicians because they're limited on what they get to bill for. And telehealth does not allow them to do their complete examination, right? And they may get paid for the complete examination, but if you're a physician and you're not able to do the complete or proper examination, but yet you can still get paid for it, there's a quandary in there that has to affect the system somehow.
Absolutely. And I also think that as me and you, or I think you said more specifically, that once COVID hit and we started doing, I think our first podcast was about, I think you said, people that are going to be effective at this medium, right? This Zoom meeting, they're going to be successful, right? And it's the same thing for doctors who are good at telehealth, right? The people that learn how to get really good at it are going to be, it's going to be a double-edged sword, because if they're really good at it, then people are going to refer a lot of people to them. The flip side being they have a certain capacity for which they could treat a number of people in a day, right? So now you've reached your capacity as a physician to bill 8 telehealth visits in a given day, because that's just the limitation, right? That's one person, everything's going through me, right?
And you're going to have some doctors saying, well, I can get 15. Right. And how are they going to do it?
Right.
They're going to cut those corners, and that 80% satisfaction rate is going to plummet.
Yeah. Right.
Or start to reduce. But
so I guess the question though becomes, there was another question that it was in here in the survey that I thought I was going to mention. It was related to, here it is right here. You said you had used a device to help measure your fitness and health. This is obviously to the survey. To what extent has using this technology changed your behavior? Mm-hmm. So the question for you is, with your Whoop, are you hoping it's going to give you feedback to say, Dan, change this? Or are you hoping it just affirms what you already know?
I'm not hoping that it tells me anything specific. I know that I would respond better to quantifiable information than I do to just, hey, I know I worked hard 3 days this week. I'm a little sore. I should probably, that's just a wild guess.
Right.
I want to make informed decisions, data-driven decisions. I have no idea whether owning a wearable that gives me all of the information that I can possibly get through wearables would change my behavior or not. I want to see the data so that I can make that determination. It might change it. I mean, for instance, when somebody finds out that that they have emphysema and they're going, they have to quit smoking right now, or you're going to die within a year. Their motivation to quit is sudden, it's strong, and it lasts, right? So people can quit cold turkey if the situation is right. So I'm hoping if I have this data, I either will look at it and go, I'm okay.
Right.
Or I'll look at it and say, I've got to change now.
Right.
So
here's the stats to the answer to that question. To what extent has using this technology changed your behavior? Again, the survey is laid out by generations from Gen Z to baby boomers, right? The answers could have been a great deal, moderate amount, a little, or not at all. So let's just focus on the people who said a great deal. 87% of Gen Z say that their technology changed their behavior.
how would they even know that?
69% of baby boomers say that they have been, their technology they're wearing has changed their behavior. Well, they would know it, right?
16. Well, baby boomers. I'm about the youngest of the baby boomers.
No, but what I'm saying is the results of whether or not your fitness or health technology changed your behaviors, you would know it.
You're talking about for the Gen Zs? I don't know. I think they grew up with it. I don't think they can say that. And maybe what they're answering, the question they're answering is, let's say you're a Gen Zer, you're 28 years old, you got a new Garmin watch last year. Has technology changed your behavior? Well, yeah, it has.
But to what extent is the question, right? Well, I was running 5 miles, now I'm running 10, right?
Or whatever,
right?
But it's a different question when you ask those kinds of people. You ask somebody, 80 years old, has technology changed your behavior? I'm going to guess that it has to be. I'm not either going to guess that because it could be either way. Well, it could be that they have been overwhelmingly changed by a mood ring.
Right. Right. But I guess draw this connection back to the Apple Watch. So right before I came down for the podcast, I just happened to watch the Apple commercial that came out with the new watch. Yep. And of course, Apple always does a remarkable job with their commercials. I always think they do a fantastic job. So the commercial basically says, I really wish my Apple Watch would do this. And then they go, it does that. And then they keep going on in the commercial and they say, well, I really wish it would track my elevation when I'm mountain biking. And they go, it does that. And the whole commercial just does that through the entire thing, right? As if to say, it does everything you need it to do, right? But apparently the big breakthrough was the blood oximeter. That's apparently the big breakthrough, because that is apparently a super good indication as to how in shape you are. And
the amount of oxygen in the blood, or the increase or decrease over certain exercise levels?
I read if you read I posted in our Slack channel the science behind it, that it's a specific thing that they're measuring, I guess. But apparently it's 3 infrared things measuring the blood flowing through your body, apparently. And so
I wonder if it's any better than the Garmin's.
I don't know.
Because Garmin's got the 3 things on the back too. Right.
Let's see here, just real quick. See if I can find it. Here it is. I don't know. So what's funny about it, as I was thinking about talking about this today, I was like, I shouldn't get Dan off on the Apple kick.
Yeah, because you know where I'm going to go with this?
Right.
This is a $300 watch.
Right.
The Whoop strap, about $300.
Right.
The Apple Watch,
I didn't look.
You don't want to look. But I'm going to guess, I bought one
$600 or $700
8 years ago or whatever, and it was $800.
Yeah. So oxygen saturation represents the percentage of oxygen being carried by your red blood cells from your lungs to the rest of the body. Indicates how well this oxygenated blood is being delivered throughout the body. So to measure light reflected back from blood. So yeah, I mean, it sounds great,
They had somebody write that copy.
right? So
It wasn't supposed to sound terrible.
right. I mean, I'm sure. Yeah. I mean, and this was the point that I forwarded you there, or I posted the article in Slack, was not because of how well written the copy was or how cool it looks, but more relevant to us was the description that now that there are these, what they're presenting as, we can track this kind of healthcare data, and we are all but saying it's reliable. Now what they're doing is, there were 4 studies that are mentioned within the article that talks about how we're going to take a feature of the Apple Watch and we're going to put it into a clinical study and we're going to measure using it. So I can't remember now all the different studies that they're talking about putting it into, but we have seen that in our DEXI project, right? With we're getting data from a polar chest band for people who exercise, right? So more and more clinical studies are being built more and more around collecting data from wearables, right?
Right.
And so the question for us, challenge for us becomes, if data is just data, getting data off of all those types of devices is as easy or as hard as what?
So, I think what is going to establish dominance, in our field around wearables is dealing with the variety of them, because they're all different. Each company has their proprietary way of talking to their devices, storing their data, offering that data back up for your consumption, et cetera. I'm pretty confident because of what I've seen over the last 5 years. I know the pattern that we are in with wearables, and they're all doing it in proprietary ways, much like HTML was done in the early days. Everybody did a little bit different, and then we come up with standards and we follow those. So we're not into the standards part of the pattern yet, but we'll get there. And pretty soon, talking to these devices will be the same, right? We just add another one, and the data will be different, but the actual communication protocol will be the same.
Yeah. So I sent this article to our client. One of the things that's interesting about that is that in the DEXI study, they originally were going to use the Verily watch, which I don't know if so it's made by Google. And the idea behind it, the creation of the Verily watch was solely designed to be used in clinical studies. And so we were going to use it, but then to your point, I think the challenge was, what were they willing to share with us from the watch? Right. And I think we had used it in the pilot study, or they talked about it, but then they were really sure we were going to use it, or the Garmin in the pilot. I can't remember now which one, but anyway, and they were talking about using them in the primary study, but then they basically said, we've had initial conversations with Verily, and they've been kind of sketchy about what they would share and how they would share it. And we were like, we don't.
And that goes back to what we talked about last week. If you can't be transparent, if you can't put yourself out there, it's off-putting. It's scary for somebody to deal with.
Yeah.
Not to change the subject, but let me ask you this. I know Apple Watches are expensive, but since you sent me that article and I glanced over it, I didn't read it in detail. I thought about, I guess if we get another research project where we have to collect this data, I'll have to purchase a few of these watches,
right,
and a few more iPhones to sync them to,
right,
et cetera. And
don't forget the iPad too.
And an iPad mini. And the prospect of that was kind of exciting. I wouldn't mind trying one out. I'm not against Apple per se.
Right.
I'm not against them at all. What I think is they're expensive. They're expensive, and they do provide a better product, but is it dollar for dollar better in terms of value? And I'm not gonna make that determination. But do you think that hospitals have enough money to issue Apple Watches at that? I mean, if they are paying for them, there's quite a range of cost in there. And I don't know if hospitals would find Apple Watches feasible. Here's another thing about Apple, and I don't know if it's true today. But when I was writing code back in 2010-ish, there was no way that you could license applications to corporations because they had to be licensed. Apple had to license them to you through the Apple Store. I'm pretty sure there's ways around that now because that was a big stink back then.
Yeah.
But the idea that they're going to own all of the relationships seems like it would make it harder for hospitals to dig in as well.
Yeah, they're you know, I mean, if you think of our study right now is 600 people across the nation, and you think of 600 iPhones, well, that's a pretty expensive proposition, you know.
600 times 2,000.
Yeah, yeah. And especially when most clinical studies are run on a pretty tight budget to begin with anyway. So, yeah. I mean, they could let people opt into them, right? If you have a watch, bring it in and we'll opt into the study. And I think that's true with the study now. I think everybody's, you know, I think we do that now because like OHSU has their app that they built, and that's, you know, Android or Apple. Right?
One thing about Apple, if they've really built the better product this time, and it is super valuable to your health through data collection, et cetera, and you don't own one and you're sick, and it would make sense for data that you've collected that your prognosis or outcome or plan of action would be better. I wonder if it could become an insurance, something that insurance would pay for.
Yeah, that's a good idea. You know, like the thing you stick in your car, right? It says, Dan, you broke the speed limit 3 times this week. So sorry.
I definitely didn't get
your rates are going up. Right. But it's the same concept.
I've seen people with those breathalyzers in their car. That's where I thought you were going.
No.
Yeah, I don't need one of those.
No, it's the whatever I forget now what they're called, but you put them in your car and it measures how, I guess, all the signals that your car gives off, right? Speed.
Oh, yeah.
And if you almost got in a wreck and
through that port down there. Yeah. There was an insurance company that was offering insurance as well, and they had an app that you'd download and it would run in the background, and depending on how you drove, how fast you braked, how fast you accelerated, other things that they weren't telling you clearly what it was about, affected your score in the end, and then they would offer you a rate. Me and all my kids did that, and a couple other people that I know did that. In the beginning of the study, they would say, hey, you're doing great. You're going to save all kinds of money. But inevitably, throughout the end of the 14 days or whatever it was, mine started off, I'm going to get a great rate. But then it was up there to the same place. And I ended up feeling like, well, maybe it was me. I tried to drive slow. I tried to be a better driver. I must suck.
Right.
But I don't think it could have been. I felt like that until I knew everybody else had the same exact experience.
Right.
And that's a great ploy, but I mean, it's not a great play. It's a great idea if they could actually do it.
You do. I mean, we focused a little bit on talking about, healthcare and from a hospital's perspective, from a consumer perspective. And if the consumers are now at the center of healthcare, you have to kind of start to imagine how that's going to change health insurance, right? If you can demonstrate out of 45 characteristics of measuring your health, Dan, then you get the best health insurance, right? What are in terms of taking the data and how does it customize the health insurance that's now available to you, right? One of the things that I read recently, which was, there's been, and partly because of COVID, but there's been an enormous explosion in private doctors where there's now a lot of companies out there that are offering what they call concierge level medical treatment, where your doctor's on call for 24 hours a day. You can access them whenever you want. And now these people are paying, $800-900 a month to get this sort of like personalized healthcare treatment, right? So I guess that's, and there's plenty of innovation. I mean, ironically enough, Kansas City's got had a few insurance startups that have done some interesting work in the insurance space. Risk Genius is one of them. Chris Cheatham, I think is his name, who started that whole enterprise. But I mean, you wonder, how is your health insurance going to change as we get more data around our health, right?
Yeah. Well, I think it's pretty apparent how it's going to change. I mean, and I'm not trying to be a naysayer and look how terrible the future is going to be. I don't think it will be, but here's what's going to happen. Our data will be collected by the insurance companies, and we will not have a say-so in it other than to say we don't want your insurance. But if we do want your insurance, you have our data. And they will give us all kinds of guarantees, but they will get hacked, and that data will be stolen. And ultimately, they will charge us based on whether we comply. They won't charge us more if we're unhealthy. They just won't insure us if we don't comply. That's going to be the future. I mean, it's kind of the way it is now with driving a vehicle, right? Driving a vehicle is dangerous, but not just to yourself, to others. And as a result of that, we can force you to comply with what we say the rules and the safety is, right? 55 miles an hour in this zone, 25 in this zone, 15 in this zone. If you're driving through a trailer park or something, it's 5 miles an hour.
Right.
Have you ever tried to drive 5 miles an hour? Fucking impossible.
No. So it sounds like not to get you started here, but are you concerned? You're concerned.
I had to get started.
You're concerned about personal freedom.
I am not concerned about it. I'm just telling you where it's going, and I don't think there's any way to stop it.
Right. But I mean, going back to the car analogy, I guess, but so envisioning a world where everything is an autonomous car, if you just want to like cut loose and drive 80,
no,
autonomous cars are going to be like, Dan, sorry, we can't agree with that instruction, right?
You want to set off a smart bomb so you can see what happens to your watches and stuff. You can do that. You just can't do it around anybody else. Right. So yes, you can buy a car. Yes, you can drive it on your land, or you probably would be able to go to an old racetrack and drive it there or something like that. But no, as far as getting it out in public, driving it around, you won't be able to do that because that's not what we do anymore. You must comply. Insurance is going to be that way too. Healthcare is already way too expensive. My predictions are healthcare costs are going to plummet, right? Because technology is going to allow it to be cheaper and cheaper and better and better. We're in that revolution now. So it's going to plummet. It's going to be cheap. And pretty soon the value of healthcare is going to come specifically from what you said we enjoy most about it now, and that's the human interaction. It's like, I don't know if I can make it, but hearing you say that you're here with me, now I can try. I can keep trying.
Yeah. I guess.
So that's what we're going to pay for in the future, is to have somebody hold your hand or look you in the eye and tell you, the test came back positive. Right. Or whatever it is. And you need that. We need to hear that from a person.
Sure. Well, I think that's what
I like your own shirt, by the way. Did you wear that specifically for the orange and blue?
I
got on a blue shirt today.
I won't show you my socks, but I just
we didn't coordinate, by the way, folks.
Right.
Not coordinated orange and blue shirts.
No, I was just looking at my list. That was what the healthcare topic. One last thing I was going to mention related to Apple. So have you heard about the Rundle?
Rundle? No, I haven't.
It's their reoccurring revenue model that they've got now. So
Rundle.
it's basically taking their cloud storage, Apple TV, Apple Music, Apple Arcade, if you want to play games, and they're wrapping it up into one thing, and they're saying you pay $14 a month for all those.
Okay.
So
Apple Music, Apple TV.
you get some cloud storage with it. And
What is Apple TV? I've never used it.
I haven't either. It's just
Is it Netflix?
it's
Is it
Hulu and right.
okay?
But what these people that just are just Apple fans, right? They're going to look at that and they're going to be like, "Oh, this is great," right? Because now you package it all together and all that. So I don't know. It was just I thought about it this week when they announced the news, and the idea that more and more companies are putting things together, right? I told you before that one of the guys that I listen to says, look, if Amazon gets to know me so well, then just start shipping me stuff. Right. So, so do you use Amazon?
I absolutely.
But you're a fan of their product service, right?
I'm a fan of I'm purchasing and having it here without me having to do anything but sit at my desk and press some buttons.
So what other types of things like that do you use? Like
other services?
Like subscription services or things that
I use Netflix. I use Amazon Prime Video, right? So I store all of my gigabytes of pictures and stuff that I've taken over the 20 years out there. And I also want to store videos. So you can't store videos on Amazon Prime Photos. So you have to buy space from them. Oh. So I have, a terabyte of space, and I have my pictures out there. I also have Google Pictures. I use Google Mail. I use Google Calendar. I use Office 365.
But you don't, so beyond the Prime account, the Prime subscription, there aren't other services like that you subscribe?
Like from Amazon?
Or like just from anybody else? Like any kind of like food delivery. Do you do?
No, not anymore.
Not anymore?
I did Freshly for a while. I did another one.
HelloFresh was the one.
HelloFresh, yeah. There's Freshly out now that is individual packaged. Right. And I thought about looking into it, but no, I don't do all that stuff. I do subscribe and save from Amazon. Right. That's pretty popular. Yeah. But most everything I get delivered or that I subsist off of either comes from Price Chopper or Sam's Club or Amazon.
So the Amazon store that they opened up in New York City, Seattle maybe, was the store that was cashierless, right?
Right.
Where you walk in, grab your item, they charge you right on the spot, and then you walk out. Or maybe they charge you as you're going out. I can't remember now how the technology works, but
yeah. But they know who you are. They know what you took. You get billed for it.
What do you think of that?
I think it's creepy. I can see where people. I honestly think that it's a gimmick.
But it's got to be imagine how attractive that sounds now.
What's the difference? Why can't you just order it?
All right.
Right? Why just deliver it? Amazon, why do I have to go into your store and not talk to anybody? I mean, I don't know. It's just
the one store I saw in New York City was.
What's the appeal to it?
Well, if like you wanted to leave here and walk out and go, well, the appeal now is you don't have to interact with people because now you don't run the risk of the virus, right? So,
sure, but Amazon has like 30-minute delivery now,
right? In
certain places, right?
But if me and you were like wanting to walk out of here, go get a bottle of water, and then just right, I don't want to pay to have that delivered. I just want to go get it.
Right, but they don't sell water. They sell high-end electronics.
No, but what I'm getting is the Amazon store that you walk into and they charge you and you walk out, right? Mm-hmm. The attraction of that is I can just go get the bottle of water. They charge me and I walk out. I don't have to interact with anybody. Right. That's the attraction, okay. I assume. Right.
Well, and I don't know what the attraction is. I certainly don't assume that. because they can buy it online and not talk with anybody too, right? And it's delivered right there. The only real advantage if you compare those two things is that I can get it right this second.
Right.
But they only sell their Apple products, right?
No, they
or
sell
Amazon products.
Well, the store that I'm talking about, they sell. It's like it's the equivalent of like a convenience store.
Okay.
It's like water. They have lunch, like boxes you can buy. They have groceries basically. And you're the one you're talking about. Yeah, they'll drop in certain kiosks with Apple products and stuff like that, right? But this one was a convenience store concept they put in Seattle and New York City, and just said it's like a convenience store.
I wasn't familiar with it.
Yeah.
I wonder if I would use it because I really like Quick Trip. The main thing I like about Quick Trip is that they're fast.
Yeah.
You know, they greet you when you come in. You walk up to the counter, they repeat, ding, ding, ding. Thank you. Have a great day.
Right. Well, and I don't know. I mean, I right now for me, the longest exposure that I get every week is in a grocery store.
Yeah, me too.
And so,
but can you imagine going into Quick Trip and there not being a guy or a girl up there going, tick, 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 have a nice day. And instead having it automation. And then what? The automation networks down or whatever, just has a screen that stares at you. Nobody around. What are you going to do?
Right.
Now you're broken. Now you've gone to a Quick Trip that is no longer in business,
Right. And no longer quick.
No, yes. Not really even open, but you wouldn't know that because you had to park and get out of your car and go inside. That would irritate me enough that I would, over time, if that happened 1, 2, 3 times, I'd never go into another store. Right. Like, not worth it. Already wasted enough time there.
Right.
I'll buy it on Amazon and get it shipped, and it'll be here day after tomorrow, and I can guarantee it. Unfortunately, anymore, you can't guarantee that. Right. I had a bunch of stuff shipped just recently, my subscribe and save each month, and 5 or 6 different items. I got a message on my orders page that said, something went wrong with this order and we had to return them. We'll refund your money. Sorry.
Oh. Yeah, that happened to me a couple
Why
times.
don't you just reorder them and send them to me?
Right. Yeah.
What do you think happens?
Well, right now, I mean,
forklift driver fucking runs over them?
No, I'm just thinking that their suppliers of all their products probably are not. Maybe there's
these products were shipped. They were shipped. They just never made it to me. And then I got an email said, yeah, they didn't. Something went wrong with that order, and we had to return them.
Oh, so I was thinking that they were like out of inventory or something.
No, they would have said, no, we don't have these. They'll ship later or whatever. But no.
So you're saying that they were
something
in
was
transit?
Shipped. Coming to my house, it didn't get there. Should arrive today. Oh, guess what? It should arrive tomorrow. Guess what? Now we're refunding it. I have no idea what actually happens.
So the guy drops a package on the floor and busts something, or
maybe, or he puts it at the wrong house, or I really don't know what would cause him to say it's shipped. Track your package. Hey, it's on the way to your house. Uh-oh.
Right.
What causes that?
Yeah. So speaking of Amazon, so I don't know.
No, really, that was a question. What causes that?
Oh, if I had the answer, I'll tell you.
Well, you do have the orange shirt on, so the all-knowing.
So they said that JCPenney's recently had gone bankrupt, I think.
Somebody bought them, didn't they?
Yeah, there was a big real estate company that bought them. And now they're in, one of the things that they talked about was that they were going to take all these JCPenney's and turn them into basically Amazon mini warehouses. And because JCPenney's is located pretty much across the entire country, they could just buy that and just open up an Amazon small warehouse just to get distribution out to you even faster, right? I thought that was a pretty interesting idea. So, yeah,
sure. Yeah. There was JCPenney's up in the Metro North Mall
till they tore that down.
Yep.
Yeah.
There was a empty store in there for a long time. I think it was Macy's, wasn't it?
Mm-hmm.
That was closed down for a decade.
Right.
It was a pretty scary place. That whole Metro North Mall. There was 1 store or 2 stores that were open last time I was in there, and JCPenney's was one of them.
And Dan, here's a fun fact that you won't appreciate at all. is that when I was a kid, Metro North Mall was brand new. So I was probably 7 or 8. And so the concept of indoor malls was just sort of taking shape, right? And in the middle of Metro North Mall, they had this giant water feature. And they had these balloons that would...
I remember the balloons. There was water in that pit at one time?
Yeah, there was water around the balloons at one point. And so, but in the center, they had a little like island where they would have like events, like people like bands would play at the mall. And they would...
Yeah.
And when I was 8 years old, Matt was in tumbling. And I had my first tumbling event.
Did you just speak about yourself in third person?
Yes, I did. But it was like, it made me like, every time I went to that mall, that's all I could ever think about was like how nervous I was when I had to get up there in front of everybody at the mall and do my little tumbling routine in front of like a whole mall full of people.
Is that where you were practicing at, or did you go in there to do
This was like the culmination of many workouts, you know.
Wow.
So
that changed your memory of the place, huh?
It did because when the final presentation, I was doing my forward rolls, which were very complex in nature, and I almost rolled into the water. So that would have been a disaster. But
yeah.
Luckily,
how old were you?
I was like 7 or 8.
Wow, man.
Yeah.
So you've been doing tumbling now for 40?
No, I had to retire.
Retired the tumbling.
I had to retire.
Shoes.
But yeah, you know, I mean, that's always an interesting thought for us. And even though we've never really done that, I know of any kind of like retail project technology work.
We've bid on a few point of sale systems, custom point of sale systems, but no, we haven't really done it.
But, you know, the amount of technology now that is changing retail is still, you know, I mean, obviously Amazon has reshaped that entire kind of world, but which did bring me back to, you know, the connection to healthcare though is, do you, but you go to the gym, so you're not working out at home at all. So
I work out at home.
Do you?
Yeah. I ride my bike and
but
meditate and do push-ups and stretch and yoga and that kind of thing.
And you're recording all you have a watch on at the time or something?
I do, but I'm not really using it. I record it because I like to get the badges. I like it to say, yep, you haven't missed a day forever.
Right.
But I don't look at the numbers. I don't track trends. I just like I get the dopamine rush by having my phone tell me.
But do you, so I think I had told you this, so I'm trying to buy a treadmill.
Mm-hmm.
And a friend of mine used to own her own treadmill repair company.
Mm-hmm.
So she really knows treadmills, like really in depth. And so I'm shipping her I'm emailing her ideas saying, hey, what about this one? Or what about that one? Or whatever. And so I don't usually call anything sexy, but the Peloton, which I've told you about, is a really kind of sexy idea. It's like the idea of putting a giant flat screen TV on your treadmill, just basically. But the coolest part is the video element of it, right? So they've hired these high-end trainers to go all over the world and film all these different people running up a mountain, right? And you're like, they're here in the video and you're watching them climb the mountain, run up the mountain or whatever. And they do it all over the world, and you get to kind of, the theory is like running with them, right? And doing all this stuff, but it's all high def TV, and the treadmills are $5,000, I think. I mean, they're real, you know, high end kind of things. Now they're coming out with a bike. But speaking of, you know, the idea of sharing healthcare data, right? It's like at the end of your workout on that treadmill, You just hit a button that says "Send to my doctor."
Your
workout.
You're suggesting that this might be a good thing.
Just send my workout. What did I do today? I ran 5 miles.
You probably just make it a sticker because doctor's going to have that data anyway.
Right.
In the future, that thing will be connected to your insurance because you will get incentivized,
sure,
or penalized for not having it. One of the two, and I guarantee you, your doctor's going to have that information, at least statistical numbers that he will be able to look at it, and it will be part of the pool of data that is available.
So maybe what's going to happen is your health care is going to change daily.
What is such a big deal about the Peloton?
Peloton. Well, now
other than the 4K TV and the nice graphics, what is the actual treadmill? A high quality treadmill?
It's gotten highly rated, yeah. But I will say this, just on a different note about that, is if you really want to find a really interesting story about an entrepreneur, you should go listen to. I think his name's John Foley, is the guy who started that company, and he had given a interview or something somewhere recently and talked about just how they started it. And it's just comical because he's like, all I knew was my wife wanted to work out and watch TV. And she wanted a better way to do it than the way that she was doing it. So we started to kind of come up with these ideas. And then the amount of iterations that they had to go through just to like get to, like they said that one of their first demos was in a mall. And they took this contraption that was the first iteration of the bike or the treadmill, and they took it and they had it on display in this, and they had rented a little kiosk, and they had taken it in, and they said our biggest worry or fear was somebody was going to ask us to actually use it because it didn't work. But what they wanted was they wanted to open up the store and get people's feedback, right? Like, would you get on something like this? Or it looks pretty cool if it's got this high def TV on it, right? And what if you could follow workouts like live in person? And so it was just kind of a test bed for them to gather. But it was funny because all the story of them just trying to build the concept of it. And he spent almost 3 to 4 years just trying to build the thing. And so I don't know. For me, I get kind of enamored with the story behind the story, right? The story that led up to the product, if you will. So,
what do you think? Will you get one?
I think I would if they were more affordable. I $5,000 for a bike. I mean,
your health is the most important thing in your life, though. So
yeah, I don't know. I think I would spend. Right now, I'm thinking about spending between like $1,500 and $2,000, and that'll get you a treadmill that's decent, right?
I think so. Yeah. But man, $1,500, $2,000 will buy a lot of gym memberships.
All right, but I'm.
You could probably do a gym membership both here downtown and at your house, and Taekwondo and Jiu-Jitsu.
Right. I don't know, Dan. You're still going to the gym though?
I do go to the gym, and I don't know if it's smart to do because I'm starting to read studies, and I know that I'm at risk, but you're at risk whenever you leave the house, right? Driving down the street, you're at risk. So for me, it's not about staying healthy. That is the ultimate goal, but it's about reducing risk. Reducing risk will keep me as healthy as I possibly can, and not working out is a huge risk.
Yeah.
So
and I mean, I think probably the studies that you're talking about are the same ones that I read, which is the amount of just air people are consuming and breathing and all that, and that the more you're around, more people talking, and
And we do have a couple girls where we work out that
like to talk a lot.
I wasn't going to say that. I was going to actually back off of that because they might listen to this podcast and they'll know who they are.
Saying somebody talks a lot. I talk a lot. I mean, I guess you're at risk by talking to me too.
So I did go into the gym with a mask on one day because I had a cough the night before, and I just I'm not going to not go to the gym. I'm not sick, but I'll take a little bit of precaution. And it's impossible. It's impossible to work out with a mask on. it's impossible to really talk with a mask on without the mask coming down over your mouth, or at least the shape of my face is not conducive to mask wearing and talking or breathing.
How many people in the gym are wearing masks?
Nobody. Nobody. I'm the only person that I've ever seen in the gym with a mask on in our gym, Eagle Fitness.
Liberty. I'm always surprised when I see people in the neighborhood running. They're like running around in the neighborhood with a mask on. I think that's a little over precautious, but
or driving in your car. Although I kind of snicker at people that are driving with their mask on. And then the other day I noticed that I was driving with my mask on because I just hadn't. I guess you get comfortable enough with it, It's just so. I've also shouldn't laugh at others because you never know where they've been.
There.
We've got about a 2,500 square foot gym, and those machines are packed in there. But the people that are in there, when I get there at 4:45 in the morning, I usually spend 15, 20 minutes warming up, stretching, etc. And there's a group of people that get there at 4, and they're just getting done about 5 or 10 after 5, 15 after 5, about the time I'm ready to get in there on the equipment. And so there's kind of 2 phases, at least first thing in the morning. And there's about 8 people in the first phase, about 14, 15 in my phase. And so there is risk in there. But every single one of these people in there is very, very healthy. And this is their lifestyle, right? They're not, weekend warriors or coming in here because it's New Year's and they made a commitment. These are lifelong people or what do you call it? Exercisers.
Right.
Lifelong exercisers.
Sure.
So they're healthy. And I'm trying to justify that to say that it's a safer gym because these people are healthy. And chances are, if they've been exposed to COVID, they might have gotten it and not even known it.
So, but the numbers of people that have stopped coming to your gym has, I assume, gone down. In other words,
I know there's two, but I don't. I know there's more than 2 that aren't there, but I've seen all of them there at different times. I think they're just going to a different class or to a different time. But I know there's 2 people that aren't coming in because of the COVID. And well, I don't know if that's the only reason. I think that might be the excuse at this point. When you stop for a long time, it's hard to get back in there.
Yeah, I just know that the gym that I was going to Planet Fitness, I was reading an article the other day that said their revenue has dipped like something like 40 to 60%.
That's amazing, because I thought they would not allow you to have membership there unless you gave them access to your bank account.
Well, what I mean is just that people have just not come back.
I know, but I wasn't quite through. So not only will they not give you a membership without access to your bank account, they, as you know, make it incredibly difficult for you to get out of that membership. Don't you have to actually write up a letter and mail it to them?
No, I had to hand deliver it.
Well, either way, most people don't do that. They call them up and they say, I'm done, don't renew. And the person on the other end of the phone says, okay, but that never happens because they can't do that because it's part of the contract.
Right. And speaking of technology, why shouldn't you just be able to say stop membership, start membership?
That's the kind of stuff, back to business ethics. I think that's unethical. It's like when you unsubscribe from an email and they say, we will have your name off here promptly. It may take 30 to 45 days.
Right.
Adobe is one of those.
Right. Yeah, I think I had an experience where I was getting like supplements sent to me. And it's a relatively new supplement company, and they make it so easy. You're just like, stop today, stop my delivery, start back up on November 21st. Right. I mean, they just make it so easy for you to stop and start.
That's the smart way to do it, man. I mean, if somebody's quitting your business, why? Right? It's either not for them, which you wouldn't want to waste your money trying to lure them back if it's not for them, or because you upset them, right? Or maybe because they don't have the money. If they don't have the money, you don't want to upset them by trying to force them to stay in. And you just don't want to upset them, right? By having proprietary or what do you call it? Predatory business practices.
Right.
And I hate that.
So switching gears a little bit, we are entering another exciting phase where we are, well, you talked about it in the previous episodes, where we have created a test for...
Let's do a test follow-up.
Yeah, so we created a test for some new candidates. We have administered the test. And so, Dan, you can kind of... So where are we at?
So what are you lobbing it up? So I am really excited, Matt. We have interviewed two young ladies, both of which seem to have a plethora of the types of attitudes and skills that we need. But I've come, as I might have mentioned already, I've come to the conclusion that I'm not really good at getting people that can actually do the job well. What I'm really okay at is getting people that I think are likable, that they can communicate well and present themselves well. And I have forever, based on those things, taken a leap of faith that she can actually do the job.
Right.
And I haven't been the best at it. In fact, I look back at my career hires and my history of hiring really good people. I've gotten lucky 3 or 4 times out of 40. So not enough that I think I can do this. No, I clearly cannot do it well. And so this was our attempt to do a little bit better. And so in my mind, what I wasn't good at was I could find somebody and determine whether they're likable or not, whether they're telling the truth or not, whether I can trust them or not. But I can't tell whether they can actually do it or not. And so with this test, we made the investment of actually hiring these people for a very short period of time and giving them what I thought was more work than they could get done to, kind of like a test that is impossible to finish. Right. How far did you get? How did you act during those challenging times? And all of those things are what I really need to know. So we gave these ladies the test, and both of them have come back this week with their results. And I was impressed by both of them, extremely impressed with not only the fact that they completed the task, they organized, 1,700 files into a directory structure that can be maintained and, hopefully will take us forward in the future. But they learned everything that they could about the project through that one source. And admittedly, probably 80% of the available knowledge was in there. But it wasn't the most critical pieces, right? The 20% that isn't in there is probably the most critical.
Right.
So the fact that they could just take that static view of the project, 1.5 years, 2 years, or whatever it was, and both of them came back with an understanding of who the players were, what the relationship had been, what had been accomplished, what hadn't been accomplished, the members of the teams that had worked on it, et cetera, was quite amazing. And I'm not sure that they would have dug in to that had we just hired one of them or two of them and said, hey, you can do it, so come on in and get to work, right? I'm not sure if they would have even taken the effort that they did in the test, right? By calling it a test, giving them 80 hours to work on it, and the results of the test will go into whether or not the decision on whether or not I hire you, might have been part of the benefit to this. We're going to have to keep an eye on that, right? And just not expect that every time, we have them dig into something that they'll do well. But the fact that they could actually do what I really needed done and come away from it with the level of knowledge that they have I'm impressed and I'm excited, and it's going to be a hard decision.
So do you think that, going back to, the previous way that you had hired, you see that as being maybe, in retrospect, that was a much more risky sort of decision that you had made to hire some people, was because you had that missing piece of that leap of faith you had to take because you didn't have everything that you really needed to feel 100% confident in making the decision.
Yeah, that's exactly it. And I didn't know I needed it. I've hired enough people, and I've hired some good ones, and I just figured that's what it is. You hire who you can get, if you can get along with them, if they're trustworthy, if they're intelligent and you can communicate. Everything else you can fix.
Right.
But what I've learned is I can't fix everybody else. First of all, I don't have the time. Second of all, not everybody wants to be fixed. Not everybody thinks that they need to be better at this or at that, or even work harder at it. They just don't see the world the way that I do, some people. And for me to think I'll hire you because you have some of the skills and I'll change you into who I want you to be is ridiculous. It's almost like marrying somebody because they have a couple of the features that you want to have and thinking that you will change them.
Right.
That's why marriages don't work.
Right. So, the added benefit, at least from my perspective, is, the way that this has kind of come together has been interesting because, now we know that what we can do is we can have a first, a continuous, if you will, analysis or review of people who are expressing interest in the job, right? So we can do just, telephone interviews, Zoom calls, to get through the initial, or are they whatever.
We got to pass that initial filter.
Right. Yeah. But now it's kind of saying maybe they passed two different filters, and then it's saying, well, yeah, they seem pretty qualified. Now advance to the test, and the test then becomes sort of the final indicator, if you will, of yay or nay. Right. But the result of that, though, for us is that you, in a way, get, if the candidate, one of these candidates who is obviously going to be selected, begins work, they are way ahead, right, on day one than.
You're right. I know what you're not going to say. We hired somebody. We gave them a couple months to get up to speed, and they weren't as up to speed at the end of that 2 months as either of these ladies were after 2 weeks.
2 weeks. Yeah, and that's what I mean that I would say that regardless of our current past experience, but I'm just excited about the idea that, day one they come in and they're like, foundationally, they understand what the project is and they understand what the challenges are. So it's not like, what my biggest fear sometimes is, like I said before, is like people walk into something and we hire them and they go, wow, this is wrong and that's wrong and this doesn't work right, that doesn't work right. Oh, this is cool. That's neat. And it's just like they are surprised by what they've sort of walked into, right? Yeah. Well, now it's like, no, we gave you everything. We showed you the entire playbook. You know what our faults are. You know what we're good at.
That fear has gone, right? Yeah. And I've hired some really good people. And like you said, when they come in here and they start looking at different aspects that they weren't aware of before, it goes through your mind. It's like, am I losing them?
Right.
Are they going to start looking for a job right now and just take my money until they find one?
Right.
All those things go through. So
yeah. So I mean, in effect, maybe this is overstating it a little bit, but in effect, I kind of feel like you're almost like you're more committed, right?
They are more committed. Yeah. Their commitment, their statement of commitment means more because they've seen all your skeletons.
Right. Well, and I also think that, this was where we left one of the candidates today, which I still think is, there are many different benefits that we're seeing from the podcast, but its ability to take somebody like these candidates and say, you want to know about us? Go watch these 10 podcasts, right? And you'll get to know everything funny and serious about Dan and me. And it's a good mechanism, not only for our clients to peer into our business and who we are, but it's a good way for somebody willing to quit their current job and go work for us and know what kind of people they're going to be dealing with, right? So from a maybe commercial for working here.
So, I was kind of surprised. I wasn't aware that we had recorded videos of meetings and stored them in that directory. No wonder it was so large.
Oh, yeah.
But that's cool. The fact that both of these ladies went through and listened to enough of those meetings to get a feel for who our clients are and who we are in meetings and how we interact, I think that is invaluable. I mean, I don't know how to put a value on it.
Well, like she said today in our conversation, one of the candidates said, I feel like I really know you guys. And part of the reason she says that is not just because of these sort of conversations we were having during the test, but because she listened to all those audios of all those meetings with all of our clients, and she knows, just how we respond and who we are, right? So, yeah, I think I think it's been a success from that perspective. So,
so what do you think about the other client that didn't use all of her time?
Yeah, it's still kind of a question mark in my mind. It's like we didn't even ask the girl today how much time she used, but
she mentioned that over
80.
the course of the using the 80 hours. So I'm pretty sure she used the majority of them, if not more, right? Yeah. I capped her at 80, but the ability either she's just super awesome at absorbing that or she went a little overboard. Either way, I don't think she's misrepresenting herself.
Like I told you before, the candidate that only used 15 of the 80 hours and said, I got it. My question is that did they do this sort of cursory review, grab the top line kind of stuff that really mattered, which again shows a certain skill in the approach, and just sort of grab the top line stuff and didn't really dig into it real deeply? Is that what she did? Yeah, maybe. Is it more valuable to us if they had dug in deep and really understood it and used all the 80? I don't know.
I think it's kind of a testament to the situation, right? If you're busy and you think you've got all you need to do that, well, you focus your attention elsewhere. If you're not busy and this is your only job prospect, or you're really wanting this job, then you use all your hours, right? You get your 15, it's organized. What else can I do? Oh, I can watch these videos. I don't know what. I think it's great that she could do all of that organization and absorb as much as she did in 15 hours. But I just don't understand why you didn't use everything that I gave you to master this.
Right. So you see it as a missed opportunity on her part.
I do.
And she sees it as look how efficient I am. Right.
And I do see it that way too, but I just wish you would have continued to be efficient while you use the more hours. So you stopped short of what you were capable of doing. And she said so herself, she's been really busy. So maybe it just wasn't meant to be.
So I guess going forward though, because again, these are semi non-technical positions, right? They're not developers, right? So
I don't know, dude. I don't think they're non-technical. They're not developers, but they're certainly technical.
Okay.
Right. I mean, just talking with our clients, you have to be able to dig further than what they said and understand what it means technically.
Yeah, and I guess all I'm getting at is shaping how we hire going forward. Envisioning, the way that changes the way we hire going forward, I think is what I was trying to get at, which is, creating the steps and the processes and the tests that we continue to refine to again, improve our ability to hire the right people and ensure that those are people that are going to be with us for a long time. Yeah. So, well, I just wanted to touch on that because I knew that was something we did right before we got on this podcast.
Yeah.
So
let's just talk about the rest of the week. I've been trying to sublease this place.
yeah.
For the audience, I don't know if we've ever talked about this, but we've got a big 5,000 square foot entire floor of Harsfeld building downtown. And we had a bunch of people in here. We were full at one point. And as a result of some changes that we made and COVID and a lot of things, we are now not using this space. We're not utilizing it. We are using it clearly because we're in here. But ideally, we wouldn't be paying the exorbitant amount of money that we're paying for this place just so that I could have a few 3D printers in
Right.
here and a couple conference rooms.
Right.
So, been working to sublease the place to somebody else to get out from underneath the burden. Man, when I moved in here, there was no place that I could rent without signing a 5-year lease. So these people that want to rent this place from me, there's 32 months left on the lease. And I think that in and of itself
Right.
should be enough
Because they couldn't
to
walk.
incentivize you. You can't go anywhere else and get this price. Well, they want more than that. They want free month's rent. They want me to pay their agent's commission.
Right.
I got to pay my agent's commission. They want all our furniture, which I added that up, Matt. And it's about 22 grand
Wow.
just for the furniture, for all the stuff that we have down there. And so we've been back and forth. And I have been proposing to the point, this last proposal, I said, you know what, I'll give this, but that's it. I don't even want to get out from under it if you're just going to try and take me for everything you can. And that's kind of what it seems like. It's like, what else can we push him for? It's not even whether they need it. It seems like, it's just to get the better of you.
Right.
And so they finally came back. They agreed to my last proposal with one small change. And that small change is they want 2 months free rent, 2 additional months free rent. So I'm already given one, and I'm giving them the furniture. And now they want 2 more free. That's $12,000. And so I'm kind of torn. Like if I give them that, I'm going to be out about $32,000 with no office space. But I'll be out from underneath the majority of the responsibility for the remaining $190,000.
Right.
The thing is, the part that bugs me is that I'm not out from underneath that responsibility. If this tenant kicks holes in the wall, tears up the place, I'm responsible. Right. I have renter's insurance, but I've got to keep that renter's insurance in case, which means it's even more.
Right.
So I don't know where I'm going with this. I really would love to get out from underneath the additional debt, but at the same time, I don't feel like, I made the obligation to stay here, and I know it's not
Ideal.
It's not ideal, and it's certainly not frugal.
So did my assumption would be that one of the things you were negotiating was they would be on the lease, and they didn't.
I tried that.
Yeah.
It's not up to me and them to make that decision.
Right.
The holder of the lease currently would have to make that decision.
Right.
So yeah, and I doubt he will. So far, the response that I've had from this property management company has been less than concerned.
Right. Which does tie into my last thing here about the day in the life of a CEO, right?
There you go.
Negotiating, right?
So what do I do all day? That's what you want to know.
Yeah.
So my answer is going to be kind of corny. It is. Because my day starts the night before.
All right.
Right? I drink very seldom, right? Because I know that it clouds my thinking for a while afterwards. And so I start off my day by not drinking the night before, by going to bed at a reasonable hour. And
what's a reasonable hour?
well, I've got to get like 7.5 to 8 hours sleep. So whatever will allow me to do that.
Gotcha.
Which clearly, if you think about it, you have to back into that from whatever time you plan to get up. Well, I get up at 4.
Right.
Why? I don't know. Well, I can tell you why I do now. I get up at 4 now because I've made a habit of it, and because I don't know when I could fit in daily workouts unless I did. I'd either have to fit them in at 4 in the morning or fit them in at 8:30 at night.
Gotcha.
So
easier than to do it at 4.
I am a morning person. I'd much rather get up at the crack of dawn or not even dawn, right? I don't care. 2:30 in the morning.
Right.
I feel good, right? Out there, everybody else is asleep and I'm out doing stuff. So,
right. You're ahead of the game.
Ahead of the game. So I get up at 4, I work out, I exercise, I meditate, because that gets me in the mental state that I need to be in to plan my day, my business day.
Gotcha.
So after I work out, come home, exercise or stretch and meditate. That's when I typically turn on the news, and I have 5 to 7 minutes of news in the morning.
That's all you can take.
That's all. Well, that's really all there is. That's
right.
I get the highlights, right? And if there's something that I want to dig in further, I'll make a mental note. And when I get to work, I will do some research on it.
Gotcha.
Shower, and immediately after I get out of the shower, I start going through my emails and my calendar. And I typically will answer on my phone, not answer, but I will get rid of all the things that don't require a response, slide them out of the way. So I know that when I do get to work and I pop up my Outlook, that the things that are in there are relevant and need my attention.
Can I just ask a question?
Sure.
So is it your goal to, limit all the communications that you're getting, or just try to be more efficient at it? So in other words, we use Slack, right? And so it seems like a lot of companies have moved away from email and more towards these sort of instant communication like Slack or Teams or whatever. I mean, are you trying to manage your day by staying out of email if you can and really just sticking in Slack, or
no?
Okay.
No, I try to manage, but this is kind of the gist of it is I try to do everything that can be done to get this business moving. And a lot of that is communication. But most of the communication that I get, like most people, like you, like anybody else, is spam. It's people wanting your attention that may or may not be at the priority level that you should give them your attention. So I get rid of those things quickly. Because for me, knowing I have 100 emails to go through adds another 10 emails. You know, the burden that I feel knowing I have those adds burden. So the quicker I can get that shit out of the way, the more I've gotten done. So I will go through in the morning and, I get emails from Microsoft and partnerships and the Microsoft store and get rid of those. I typically end up with 10 or 15 emails that I need to respond to, clients or vendors or whatever. So first thing I do is I get that out of the way. I always check my Slack. And typically at the time of the morning that I'm getting ready for my day, there's nothing in there yet that requires attention. Most of it is just information that I should be aware of. So I get that crap out of the way. And then on my way to work, I listen to books, right? So audiobooks. The current one being Powerful, Building a Culture of Freedom and Responsibility. That was the Netflix human resources person.
Oh, right.
Patty McCord.
Yeah.
So I have to, I think, keep my mind in shape by doing things that I call mental hygiene. For me, mental hygiene is continually learning, continually listening to new things, continually seeking to understand something better that I know too little about. Health is one of those things, how muscles are built, different things about healthcare and lifestyle that I want to know about. But it is the act of learning that keeps me sharp. And if I stop flossing, for instance, my teeth are going to rot out of my mouth. And if I stop learning, I think that's my biggest fear is, my body's getting old, right? My joints are getting a little bit old. I'm 56 years old. I don't want that mind to slow down. I know that that's just the way that the body works.
Right. So, when you are coming in for your day, do you every day, do you plan your day out or?
Well, so far you've heard it just
right.
I don't go through my email and start planning. I look at my calendar in the morning. That's the one thing I do. I look at my calendar to see what's on there. And then I go through my email and swipe everything out of the way that's crap. I usually just look at Slack so that my badge of unread messages goes off. There's never anything in there that addresses me that I haven't already addressed.
Right.
If somebody messaged me and puts my name in there, I address it immediately, regardless of the time of day. But so I get all that crap out of the way. That's basically what I'm doing. I'm getting when I open up my phone in the morning, I see red dots all over it. And those are the notifications, messages. I get that shit out of the way and I do it quickly in the morning without really paying a whole lot of attention to it so that I can focus on my book on the way to work. But my intention is to not engage in thinking about anything stressful or work until I get here. Because I need to have some time off. And so I force myself to. But once I get here, I've got all the shit out of my way, all the clutter. I'm ready to go through my email and plan my day. And so that's typically what I do. I will go through my email, and if there's anything in there that requires a calendar item, I'll put it on there. So when I'm done with that, I usually have a plan. This is what I want to, or I have on my calendar to do today. In addition to that, I have things I want to accomplish that I usually have written on the board back there, long-term things. And if I have a big chunk of day open on my calendar, I will put one or two on there.
Gotcha.
And typically those things are talking to new vendors, right? Because I have yet to find vendors that I'm in love with and wouldn't consider not changing, right? I'm hoping to in the future, but I have yet to find them. So I am constantly talking to vendors, those vendors that I do want to negotiate with, back and forth, reading contracts, trying to get my side without taking, something that they need on their side. I do want to negotiate to get a better end of the bargain, but at the same time, I'm learning, and I kind of know, right, that any fight you're in, you suffer damages from it, even if it's just in a verbal argument or, and that argument that we had with Peter about the contract and just, no, it's just these words, that took a toll on our relationship that, I'd like to think that we recovered from it, but I know inside I haven't. I took note of every time that he did those things, and I still remember them, right? It's not like I'm trying to hold him against him, but guess what? When we get into a situation like we're in right now, and then I find out there's this other thing that also happened, it's not that other thing that forces me to leave. It is the accumulation of things.
Absolutely.
And now we're leaving.
Right. How do you, I know it's just, the three of us and the development team, but how do you know what's going on with the projects? Like, how do you day to day know, hey, Children's Mercy's project's going well or not going well? Or how do you kind of keep track of that? Or do you feel you need to? Or
I do feel I need to. Usually I do that through monitoring the conversation between the project manager and the development team.
Yeah.
Lately, I don't feel like that's a very good judge, just because I am completely, I don't really think that the person we have running the projects really understands what he's doing, right? I don't know that he understands the words that he's putting on the paper, right? I think he might think he understands, and I think the developer might think he understands what he said, but I have no confidence that what the client wants is getting built.
Gotcha.
And so I am paying attention. That's why I'm getting on the calls and listening to the client. And I have not heard any dissatisfaction, clear dissatisfaction on their part. So how do I typically know? I talk to the project manager, and I have great faith in that project manager. And when I don't have, then that's a problem. It has been a problem a number of times throughout that particular project, except for when you were running it.
Right.
And even then, I thought there was a lack of technical prowess that was needed there.
Sure.
So that's how I stay informed. I listen to the conversations. I watch them.
How many hours a day do you think you dedicate to new business, like sales or new business?
It changes over time. What I would love to do right now is dedicate a large portion of it to it. But I'm not because I don't know where you're at, right? You and I haven't gotten on the same page as far as what I need to do to support sales, what you're doing to support sales.
Right.
And I figured we would at some point, but.
So if you were to say the biggest gap right now missing in the business, obviously every company wants more business, right? That's always that gap will always exist in most business owners' minds because they could always use more business, right? Obviously there's a gap in staffing in terms of our current project manager, his ability to,
between where we are and where we want to go, a gap.
And I think that, and I guess what I'm getting at to kind of key in on two of those things was two people solutions. There's the right project manager, product owner, whichever we're calling it. And then there's the sort of architect piece that I think you're sensing that we also need, right?
The technical architect.
Right. Because when you say like technical prowess, like I fully admit in my role in that I'm not the most technical person, but I also think that the overall architect is still a gap that we're trying to fill.
I agree. I've always been the architect at every place that I've gone, every project that I've worked on. I've always been one of, if not the only architect on it, because I love technology and I just understand how things fit together well. But I'm worried now because I have been running this business and I really don't do much getting out there and playing with the new stuff, the new technology. And that's how I used to stay abreast of it. Like I'm always coding. I'd go home, I'd say hello to the wife and kids and start coding and finding the new things and playing with them. And I'm happy to say that I've kind of grown out of that.
Yeah.
I'm also feeling, like you said, that there's a little bit of gap between, I really think that I need to be the guide. Illumisoft needs to be the guide for our clients. And that means that we need to understand the map of the land, right? And I do understand it, but the longer I go without being on the land, actually traversing the hills and valleys of it, the more I worry that there's a pitfall in there that I'm not aware of. And so I really want to get somebody that's young and hungry and
has that skill set,
has that same desire to understand it all and to play with it.
Yeah. So the reason I asked the sales related question, what minute mark are we at before I bring up RSI?
2 minutes, 2 hours and 1 minute. Good job, man.
One of the things that I learned and observed from my time at RSI with Bob, the owner, was, a favorite term of ours lately has been abdicated. There's two schools of thought. There is the school of thought that says, I I hire so people can do that work, right? I hire salespeople to go do that work. I hire developers to go do that work because I don't need to be doing the work. I'm the owner of the company, right?
Yeah.
The other school of thought is I need to be involved to a degree in those things, right? I need to have at a high level to know what's going on with sales. I need to have at a high level, right? And the abdication of those roles is where I've seen small business owners fail, where they've said, you know, I don't need to worry about sales, but all I really care about is, are we getting new deals, right? They don't, you know, or they are completely out of involvement in growing their own business, that they're surprised when they look up and it's not growing, right? And so I think that was a mistake that Bob had made. Was he woke up one day and he realized he had been paying attention to sales and he hadn't been participating in it, right? Because Bob was like, in my experience, it's not very similar to my experience with you when we talk to new clients. You get Bob in a room talking about solutions to their problems. He was I wouldn't say he's a genius, but he was so knowledgeable. He had so much knowledge about how to go about doing things and saving money for clients and coming up with creative ideas for that he was just really good at it. But there was a part of him that didn't enjoy it. You know, he didn't like people very much. He didn't like the whole process of sales, you know, and, but what he sure didn't like even more than all that was he sure didn't like it when we didn't have any more work to do.
Yeah, but
yeah. And so, you know, I think in my opinion, and I've never been in your position before, but in my opinion, every day that I'm in it trying to continue to make it run, I'm spending like, how do I continue to find new projects and new work to keep this thing not just surviving, but thriving, right? And that's where I think I saw Bob take his kind of eye off the business. Was he had abdicated all of the sales to a sales team who weren't performing.
Was that you when he put you in charge of that?
Yeah, afterwards, right?
And it was when you left, he had nothing, right? He had completely abdicated everything about business development to you.
Yeah, and that was it. That had its own set of risk, right? I mean, he abdicated it to a team of people who weren't being managed and weren't performing, and then he got rid of the team. And then he abdicated it to one guy, and then that guy had all the most recent sales efforts in his head, right? And then when I left, they never replaced my position. They didn't replace them with another national person to bring in business, and nor did Bob have any interest in going out and doing it himself. But so they slowly kind of died a slow death. But
what happened to him?
Julie and I talk all the time, but I think it's probably. I mean, the business ultimately went out.
Are you connected with him?
Who, Bob?
Yeah. Bob, the owner.
I think he's dead.
Well, on that note, folks.
No, I think he was in his 60s at the time that I started working with him. So he was pretty old even when I left. He was probably in his 70s, I think. So and Bob was a no filter Pall Mall smoker for his whole life.
Nice.
So,
did he smoke in the office?
He did.
What the F?
We obviously couldn't anymore, but yeah, he
if it's his office, he can do whatever he wants.
Yeah, he went to the extent of having a fan put above his office so that could suck the smoke up.
That's pleasant.
And the fire department came in and said, that's actually illegal. You can't actually smoke inside the building.
Oh, yeah?
And he said, well, what I put this fan in. And they're like, yeah, it's still a problem. And he had some deal with firefighters that they wouldn't cite him for, I don't know. He had some dedication there, right?
Was it his building?
Oh, it was the 1828 Walnut building.
Oh, well,
yeah.
So yeah, it wasn't.
No, he was leasing 7 floors. But my point is, in asking you about how you look at your day is.
I knew we'd get around to this.
Yeah. No, it's just that a friend of mine used to always say, if you're not growing, you're shrinking, right?
Right.
And so whatever a business owner can do every day to come in and actually grow the business. Bob would famously, I think I told you this before. Bob would, and I'm thinking of the way you're describing your day, and Bob would come in for his day. He would do exactly everything that you talked about you did, Bob, except the 4 o'clock workout. But he would come in every day and he'd go through all his email and he'd look. And then immediately what he would do is he would dive into the minutia of a project, right? It'd be like the equivalent of you getting into the code base of a Children's Mercy app and just getting in and just reviewing line item by line item, all the code and just going through, what about this? And how come we're doing it this way? Why aren't we doing it? That's what Bob would do because that's what he was comfortable doing, right? Mm-hmm. But if I would come in and say, hey, Bob, let's go to Pittsburgh and talk to this potential new client, he'd be like, oh, no, you go ahead, Matt. He did. And it was dumbfounding to me because it was like, this is an opportunity for you to grow your business and you would rather sit in the code base, right? And that's the lesson I learned from that experience.
So what lesson should I take from this talk? Are you implying something?
No. What I'm getting at is that as small business owners, every day, right? Every day that you come into work, you've got to be pretty dynamic, right? Because today you got to deal with a lease, right? Tomorrow you come in, but at the same time, everything comes back to full circle when it really comes all down to it is, in order to grow it, we got to have more business. And if that's my chief responsibility as an owner, right? And if you're not paying attention to that and you're not working on that yourself, then you're going to wake up and not be happy with the result of it. And
I hope I wake up and I'm happy with the result, Matt. Yeah. I'm not saying that I'm not working on it, but I have entrusted you with that approach and that responsibility. And I'm here for you. Right. I'm here supporting you. And if you ask me to go talk to a client, by God, I will.
Sure. I know.
And I'm hiring vendors, replacing vendors, trying to get the right fit for that too. So,
yeah. And that's all I'm getting at, Dan, is that the people that are listening who are small business owners that may in their minds convince themselves I'm too busy working on my business to focus on sales. It's a flawed level of thinking. Right.
It is. But I think that's something a lot of people take from the E-Myth, right? Is that they've got to hire somebody else to do it. They can't do the work themselves, or they're building a job that they then have to do. And it is true, but I think you've got to do the job until you can afford to hire somebody to come in and do it.
Right.
It's a little bit difficult to know when that is because you get tired and you're working 2 jobs. That's what the life of a entrepreneur is, right? You're working the technician job, and you're also trying to be the salesperson and the accountant and everybody else.
Okay.
So I think abdication is a bad thing, but I think also at some point in any entrepreneur's career, it's the better choice than to do it yourself.
Right.
Like Bob, somebody's got to get in there and look at that code. Why not it be him, right?
Yeah, right.
If he had abdicated that, or he couldn't abdicate it because he knew how to do it. But if he'd have turned his efforts towards what actually needed done, taught somebody to manage the code, maybe things would have turned out a little bit different.
Yeah, and to be fair, I mean, Bob Cash ran a successful business for over 20 years. He did go bankrupt at year 5 or 6, I think. But I mean, the man was in business for 20 plus years, so he did something right. So. But yeah, I think that's helpful for people that are listening to understand the way that you walk into your day and how you prioritize your day and what things that you try and at least address or just what you're doing because.
Well, I tell you, in a nutshell, Matt, I'm handling all the communications that have to take place. I try to do that efficiently. Then I handle all the meetings that need to take place, right? And I'm meeting with vendors, and I'm meeting with the team, and I'm meeting with clients, and then I'm meeting with the team again and doing work. And in addition to that, occasionally we need to find some people. So
Right.
I can't really give you any numbers around the ratio of time I spend on any one thing, right? Because you never know what's coming next. But I do know how to prioritize. And so
Right.
when we decided that we needed to get a project manager in here, those things took priority over my getting into LinkedIn and reaching out to people that way, right?
Sure.
So I'm lucky to have you to be focused on that, and still managing a little bit of the My Care
Right.
project. But I'm really looking forward to, like we said earlier, to handing that off completely.
Right.
Giving somebody else complete responsibility for it, somebody that we can trust to do a good job, hopefully better than either of us have done.
Yeah, I think that on that note, hopefully this time next week we will be able to share some encouraging news on some people.
Yes.
So-
Yeah. So at the next podcast,
Yeah.
podcast number 11 next week, folks.
Right.
Until then,
Yeah.
have a good weekend. Enjoy whatever it is you do.
Bye. Bye.
All right. Bye.